Take a look at this segmented bar graph. It illustrates a striking clinical disconnect. Right now, 55% of men report feeling dissatisfied with their physical size, yet simultaneously, 85% of their partners report being completely satisfied. This gap in perception defines the clinical condition known as small penis anxiety, a state of distress increasingly linked to the unrealistic physical standards broadcast throughout adult entertainment. The result is that millions of men spend part of every single day obsessing over their dimensions, desperately seeking out dangerous fixes for bodies that are already healthy. To evaluate whether any physical enhancement cure actually works, we need to bypass the marketing and look at the hard clinical data to define what anatomically normal actually means. This bell curve represents the global medical consensus on human anatomy. The peak, representing the average length, sits at 5.2 inches, or 13.2 centimeters. Curious, precise tone. When we zoom out to the extreme left tail of this curve, we find the clinical definition of a micropenis. Medically, this strict classification applies only to an anatomy measuring under 2.9 inches, a condition occurring in 0.14% of the population. That leaves 99.8% of men with standard, functional anatomy. Yet a multi-billion-dollar enhancement industry continues to thrive, profiting entirely by treating a physical deformity that does not exist in their patients. When we put physical interventions under a clinical lens, the most commonly marketed, least invasive tools are vacuum erection devices, typically sold as pumps. These devices manipulate fluid dynamics, temporarily drawing blood into the tissue. But creating a temporary fluid engorgement is not the same biological process as cellular division, and it does not result in permanent tissue growth. If we strictly follow the medical literature, there is exactly one non-surgical device that has consistently yielded a measurable physical enhancement: the penile extender. This microscopic cross-section model demonstrates how that device works through mechanical traction. By applying slow, sustained horizontal tension over long periods of time, the tissue cells are forced to gradually elongate and divide. But notice the red warning indicators flashing along those tension lines. That minor cellular expansion, yielding an average gain of just 2 centimeters, requires mandatory hours of daily use and carries high risks of tissue bruising and severe nerve numbness. The only medically verified non-surgical method on the market demands immense, often painful lifestyle sacrifices in exchange for barely noticeable anatomical gains. Moving further up the intervention spectrum brings us to the most drastic physical measures available: surgical alterations. The most common surgical route is a suspensory ligament incision. This procedure requires a surgeon to physically sever the primary anatomical anchor connecting the tissue to the pubic bone. Detaching that ligament allows the anatomy to drop further forward, creating a temporary optical illusion of added length. In exchange, it permanently destroys the body's structural stability and natural angle of elevation. And then there are unregulated penile injections. Instead of promoting organic growth, introducing foreign substances into the body triggers violent tissue trauma, eventually corroding the internal matrix and leaving behind dense, hardened scar tissue. The clinical data on these procedures is so grim that the Sexual Medicine Society of North America explicitly warns against them. They classify both the surgeries and injections as highly experimental, noting their poor clinical outcomes and extremely low patient satisfaction rates. Attempting a surgical enhancement on an already healthy body rarely results in medical improvement. Almost universally, it leads to irreversible physical disfigurement. There is a highly effective, risk-free cure for this obsession, but it exists entirely outside the operating room. This clinical flowchart maps out the typical outcomes for patients experiencing size anxiety. Notice that when men are directed down the path of professional psychological counseling rather than physical intervention, the vast majority completely abandon their desire for surgery. The therapy works by directly addressing the culturally induced body dysmorphia. It helps men realign their perception with reality, allowing them to recognize that their bodies are already perfectly functional. Treating the psychological obsession resolves the distress at its source, removing the perceived need to traumatize a healthy physical anatomy. Your biological health is worth far more than the empty promises of internet myths. If this breakdown helped clarify the medical reality, hit the like button and share this video to help protect others from making a life-altering mistake. And if you want to keep cutting through the noise with unfiltered, rigorously researched medical science, make sure to join our community by subscribing. Next week, we are opening up the clinical archives to investigate the horrifying history of illicit penile injections, tracking down the exact disastrous substances people have desperately injected into themselves. Until then, remember that taking care of your natural health will always serve you better than chasing a dangerous, experimental quick fix. Thanks for watching.